Now, Doc Talk on KUGN News Talk 590.
It is Tuesday morning, just past, or just about 8:20 now, on Tuesday, April the 29th. Grant Mackill, Storm Kennedy, and our co-host, of course, is Dr. Geoff Simmons. Good morning, Dr. Geoff.
Good morning.
Wow.
We have Dr. Bigley here, and he's one of my gurus, one of my heroes when it comes to computers.
Thanks, Geoff.
Yeah, no, it's true. It's true. I went into learning the computers for the hospital or for the offices. I was sweating bullets. And if it wasn't for you and a few other people, I'd probably be early retirement.
So this is the gentleman you were talking about, 6 months ago when you guys were changing over?
I started off swearing at him at first, and then I started thanking him. But that's not why he's here, but I think it'd be interesting to go back to it if we do have time. There's another phenomenon that's coming along. The Sacred Heart is at the front edge, or the leading edge, or maybe the back end. I don't know where this is going to go, but it seems to be front edge, and it has to do with shared appointments. And so perhaps, Lorne, you can give us an idea. We sort of know about you, but maybe give a little bit of background on yourself, and then tell us what are shared medical appointments.
Background about me. Well, I'm from Cleveland, Ohio, home of the Cleveland Indians. Was an Indians fan my whole life.
I'm sorry.
Went to a long-suffering Cleveland Indians fan, but it's kind of how it goes. Did medical school in Cincinnati, at University of Cincinnati, and residency at University of Utah. Spent a year and a half on the Navajo Reservation. Went to Olympia for 10 years, and then here for the last 12 or 13. And been at Peace Health for about 7.
And your family medicine.
Family medicine.
All right.
And an extreme interest, I think, or hobby, or both. Computers, huh?
It just fascinates me. I'm always been a believer in trying to do something, really work hard to do something at first, but then that will make it easier for you to do it later on. And that's sort of what computers do. It allows you to do a lot of work on the front end, but then it makes your life easier on the back end.
A lot of us aren't like that, and of course I don't want to go to computers right now, but it is a big thing that he does for us. Incredible. So anyway, back to what are shared medical appointments? Shared
medical appointment, it's a team effort. It's where you have about an hour and a half face-to-face with your physician, and you have several people in the room with you. Usually there's 10 to 15 patients at a time, and you get to have your one-on-one appointment with the physician, and then the next person has their one-on-one appointment with the physician.
In front of everybody else.
In front of everybody else. And the idea is that you may come in there thinking you have hypertension, and that's what you're following up with. The next person may have diabetes, and that's what they're following up with. But they also have hypertension. And maybe the person who has hypertension, his wife has diabetes. So just with those two patients, you're learning about things that you're not necessarily coming into the doctor's office to learn about, but it's relevant to your personal life.
Sure.
So can you describe this, walk us through what we're talking about? It's kind of confusing to folks. And what about private information?
Sure, I'll tell you. How it works is people start coming in in my office, my appointment starts at 1:15 and it goes till 2:45. So it's an hour and a half face-to-face with me. The patients start coming in about 20 minutes or so beforehand, and I have a team of 3 assistants at that time trying to get them all in, get them their triage, getting the review of systems done, checking their immunization status, other things that they may need. Doing at least half of them before the appointment starts, getting them into the room. In the room, I have a person called a behaviorist. This is a person who sort of helps me run the meeting while I'm concentrating on the medical issues. She's concentrating on the group dynamics. After she gives an introduction, has them sign the HIPAA agreement, which is the patient privacy statement, saying that everything you learn in this room can be shared with anybody else, except you cannot share people's names or certain circumstances. Everybody signs that form, and then she explains the ground rules of the group visit. Then she turns it over to me. I have my computer in front of me, and I look at the first patient's information, and I start having a one-on-one appointment with that person. I get there just like you do in your regular doctor's office. We do a history of present illness. I even walk over and do a physical if it's appropriate. Now, if it's a physical that involves bearing a body part that ought not to be bared in front of other people, we can go into another room, and there's an exam room just off of the group room area where we do that. And when we go away to do an exam, the behaviorist then leads a little discussion about whatever the topic is that the person was talking about. I may go off for a minute, come back, explain to the group what I found on the exam, so they're all very interested. And then I tell the patient, give my patient my advice, prescribe medications, send them off to the lab, get X-rays, whatever needs to be done. And then I turn my attention back to the computer while the behaviorist leads about a 2-minute discussion about whatever topic was talked about at that time. At the end of my reviewing of the chart for the next patient, I look at the behaviorist, give him a and then she says, okay, stops the discussion, and I start with the next patient.
And they're all in the room together?
That's right.
Do you think they hold things back, or what happens to the ones who, which typically happens to me, they have 4 other things they want to talk about?
Yeah, they're told to bring the thing that's most important to them, realizing that other people are going to be bringing other things that may end up being very pertinent to the other things that they were thinking about bringing up.
So you're going to need a second appointment, maybe.
Frequently that happens anyway.
Yeah.
You know, I mean, it's difficult these days to talk about 6, 7, 8 problems that a lot of people really kind of hold back.
Yeah, right.
But in the group visit, what you do is you bring your 1 or 2 most important problems, but there are 10 or 12 other problems that are discussed. And there's frequently a lot of overlap, as the human condition is varied but also has a lot of commonality.
Do these patients know each other?
No, but afterwards they do.
Intimately.
You know, it's funny. I remember the first one that I did, we had 6 patients in the room, and the first patient had a really severe herniated disc. He was very uncomfortable, and he did not want me to do any kind of exam in front of the patients. So he and I went off to the other room. I did my exam, and when I came back, the behaviorist says, these 5 other women, they all want to be doing these visits together every week. They love each other. And there were from ages 30 to 75 or 80 in this first group. And this is just amazing. I think one thing they have all in common is they have me in common. So if they like me, they tend to like each other too.
This is extremely interesting. It's quite a change from how things have been. I'm having some hesitancy myself. I want to see it before I believe it. And we talked about this off the air, and I probably will go see it. I think there's some personal issues that are going to be difficult for them to deal with, and he'll answer that. But how did this come around? Is this brand new? Are we an innovator here?
We're more of a follower, I think. I think we're among the first in this area to be doing this, although I think some folks at the Volunteers in Medicine Clinic have dabbled with it, and I know some people have done group visits for single problem visits. I know Dr. Chaplin has started doing some diabetes groups, but I'm not sure how successful that is. But what I'm doing is varied appointments. Varied
issues,
problems, exactly, which is very different from what's been tried.
I can see all the emphysemic patients being in the same room and talking over the same issues. That seems to make more sense to me, but you've got a mishmash, and it works. Yeah.
The problem with having the same groups, the same types of people, is that there are only a finite number of patients with that particular problem in one specific practice. Mm-hmm. For example, in my practice, I have 100 diabetics. But to find 100 diabetics, or to find even 10 diabetics that week who want to come that time, that's 10% of that universe of patients.
Oh, sure.
Where if you open up to everybody, it makes it more likely to have enough patients to make this successful. And there's an amazing number of things that are, even though they start off with a different problem, there's a lot of universality to the human condition, and people learn from other people.
He's always positive. I don't know what he smokes in the morning.
You said this has been going on for 15 years?
Yeah, it was about that. I may be wrong. It may be even longer than that. Dr. Ed Knopfsinger, he's a psychologist, and he brought about this process at Harvard Vanguard in Boston. And he got to the point where he was adding on about 1 new group a week.
Wow.
That's wild. And they're not forced to do this.
They're not, although he talks about a story about this one doc who was a curmudgeon, sort of like you, Geoff, sometimes.
I can identify. Thank you.
And he was kind of following
Just
him
got
around.
back at me, didn't he?
Yeah, you're like, I know him.
We can tell you guys have been working together for quite some time.
Anyway, he would follow this
We're
guy
done
around.
with you now.
Yeah,
thank you for coming.
And he would go to the cafeteria and say, "Oh, you got to try group visits." He would follow him around and say, "Oh, group visits, the next best thing to sliced bread," and all these things. Finally, the guy says, "Dang it, okay, I will do what you want me to do. Just get off my back." And he tried the group visit. He gave it a couple months. Dr. Knopfsinger went away, came back. 8 years later, this guy is still doing group visits.
Oh, wow. You see, this is your future, Dr. Jeff.
My future is probably assisted living. So why is Peace Health doing this? They think this is going to save them money, improve patient care, all the above.
Well, I have to say this has kind of been my idea all along. I've wanted to do this ever since I've learned about group visits about 5 or 6 years ago, and it's been a process of trying to get the space available in my South Eugene office. However, once I started talking about this, the powers that be at Peace Health say, "Wow, this is a great idea." You know, it's a patient pleaser. It's a doctor pleaser because it just kind of breaks up our day, and it's a lot of fun. And, there's a lot of burnout that's happening with doctors, so they thought this might be helpful. Plus, it could help maybe increase a little access, where normally we would see 6 patients in an hour and a half. Maybe we could see 10 patients in an hour and a half and still deliver the same high-quality care. In fact, higher quality care because it's being delivered in a team effort.
See, I see it at this point as being, can I get done by the time allotment? That's our style always.
Right. So how this works, it is a team effort, like I said. I have a scribe in the room. She is with her computer, part of the circle, so she can hear everything that's going on. She's doing all of the HPI. Eventually, we'll get her doing the physical exam. So when I'm doing my physical, she could document my physical. Right now, I do a lot of that because, as you say, I'm kind of a, quote, computer whiz. Yeah. It's fairly easy for me to do.
You're quick at it, and you know where to go.
Right. So by the time that visit's done, more than half of the documentation is already done. So all I do is just kind of do some cleanup at the end. I type in a few things for the assessment and plan, and then I go on to the next patient. Or I do that after I'm all done. Lately, I've been doing it after I'm all done because I want to concentrate on just taking care of the people in front of me.
Is this the way of the future? Am I an old man who doesn't want to go there?
You need to sit in on one of these.
I'm planning to.
Yeah.
I'm planning to. I want to see what this is all about. I can't see myself having fun yet at it, so I really do have to take a close look. I got a question on my phone. How do you bill on this?
It's the same exact way you bill for a one-on-one appointment. If it's a straightforward problem, you bill level 3 is what we call it. If it's a more complex problem with changes in medication, then you may have to bill a level 4. But as far as the patient is concerned, they see it exactly the same way as doing a one-on-one appointment without any extra cost.
You had mentioned we have to go to a break first, right? I want to come back to depression.
Okay. Oh, all right. There you go. We will be speaking at depression next. And, of course, the main topic is shared medical appointments with Dr. Lorne Bigley.
Yeah, I think we're doing a fascinating thing. It's somewhat fascinating and somewhat scary, very interesting, and very new, although apparently the history goes back some. It's certainly very new to us. It's quite new to me. I've kind of known it was out there. Do you think the doctor shortage, there's like 13,000 people in this town who don't have doctors, is driving this, or is it driving itself? Or?
Well, I think it's driving itself. I think it's just been out there around the country and Canada for the last decade or so. And I went to a conference a couple of years ago and heard some lectures about it, been reading articles about it. I got excited about it. And it just so happens that now we have a doctor shortage, and this is a potential possibility to help that a little bit.
We're talking about shared medical appointments.
And you got to watch out when he gets excited about something. Get out of the way. I mean, like I say, he's our computer guru. All right, so suppose we have a group of people who are depressed. I mean, there is a ton of personal information, including being suicidal, maybe homicidal, but certainly suicidal, wrecking their job, wrecking their life. I mean, can you do that as a group?
Well, yes, you can. It can be done. And Dr. Knopfsinger, the guy who founded this thing, has talked about groups that have included folks who are depressed. I could say in the group that I did, in the groups that I've done over the last 6 or 8 weeks, there have been several people who've come in with follow-up depression or new depression or worsening of established depression. And there was this one patient who was having her issues with depression. She was talking about how a family member was very ill and she was her support. And the person who was sitting next to her put his hand on her shoulder and just gave her some comfort. And I asked her afterwards how that was. She goes, that was really, really nice. She felt that there was not just me giving the support, but she had the support for the whole room, and it was much more powerful even than what I could give her myself.
A lot of people feel they're alone in this world fighting it. So that probably, and we do see that with alcoholics. We do see, this has been going a long time with alcoholics.
Yeah, AA, all those meetings that they have, there is a group support that happens that's really helpful.
And some of this happens in cardiac rehab. So it's out there in ways and forms already. There is an enormous weight on Peace Health. You think a lot of other doctors are going to start doing this?
I'm hopeful. I keep working on the docs in my office. I think there's at least one doc in my office who will do it.
Have the docs in your office sat in with one of your medical appointments?
They sat in on our mock appointment that we did with our staff as a way of just introducing everybody to the concept and giving everybody who was doing it a trial run in a sense. And they'll say, "Oh yeah, it's good for you, Bigley, but I'm not sure about me," you know. But really, what they found is that people, even that Curmudgeon in Boston, who had the hardest time trying to do this, once they get doing it, they really like it a lot.
And the Curmudgeon over here, too.
Yeah, I know.
I want to hear a report back if you go to one of the shared medical
I'm
appointments.
definitely interested. Thursday's not the easiest day for me. My schedule's so packed.
You say Thursday, too, because we were talking about this off air about how it all works in the setup, because I think when we first introduced this morning, we were all kind of going, what's going on? Could you kind of go over the setup once again,
what
Dr.
does it
Bigley?
look like?
So anyway, so how it works is everybody comes in, and they go into the receptionist, check in. My assistants bring them back and do their vitals, bring them back into the group room where they're sitting in a semicircle or a circle. Part of the circle has the behaviorist, who's the person who helps run the meeting, and I have my computer sitting at part of that circle, and I have my scribe, who's also part of the circle. And then we start at 1:15 promptly, and at 2:45, hopefully promptly, and
this is on a Thursday,
I
guess I'm asking about the day and how do people sign up and how do they decide on a shared medical appointment?
They sign up just like you sign up for a regular appointment. And there are two ways that they're coming in generally. One is at the end of their regular appointment with me, I'm saying, I think the follow-up would be good to do this in a group setting. And they go, oh, what's that? Oh. And I tell them, I give them a 1-minute spiel, and they go, okay. And then my assistant comes in and schedules them for the group visit at Thursday at 1:15. Another way is they're calling in on Tuesday or Wednesday, and I'm booked solid the rest of the week, except I have 2 or 3 slots open in the group setting. And they say, well, Bigley's kind of booked, and the rest of this week, if you really want to see him, how about coming in the group setting? And then they have to sell the story because it's a different concept. People are just not used to it. But then, again, once they get in, I've been doing surveys. I've been doing exit surveys on every patient that we've done, and more than 95% of people who've done it, have wanted to do it again.
Oh. Wow.
Are they self-selected, do you think, or
I think
not?
there is, of course. Yeah. I think there are some people who, who may be having some bowel problems that they're very conscious about, or gynecological issues or something like that. They don't want to do that in a group setting. Or
I'm kind of a private guy, and I can't see myself doing this.
Right.
And so, also, there's probably doctors who can do this well, and there's doctors who should stay away from it.
That's not what they say.
Really?
Yeah.
Really?
They say, you think, oh, this is great for extroverts or people who have a theater background or something like that. But they found even the introverted, shy physicians, nurse practitioners, PAs, they've all been very successful in these groups.
Well, probably because the patients bring it out in them, maybe.
Perhaps.
I mean, in a group setting, once you get going, I assume it just kind of takes off.
And do the people from the sidelines jump in when you're talking to the one individual?
Not very often. One time, just in my last group, a patient was talking about how she saw one of my partners for an ankle problem, and he said, stay away from ice. And because I think there might have been a blood clot or edema or something like that. And she said that she was putting her leg in ice, then putting it in heat, and it made it feel better. And another patient says, can I ask a question? And I go, well, go ahead. Why were you doing what the doctor told you not to do? So that did come out in the last group. So, but not very often. Usually it's just me and the patient, and then they talk after I'm all done.
And your scribe does your prescriptions and orders your labs, or?
Well, again, I could do those pretty quickly, so I do them myself. But the theory is, once my scribe is doing quite well, I can imagine her doing those if I choose to have her do those. And I imagine other docs who are doing groups can choose to say, please refill his propranolol. Please order a CBC and get a chest X-ray and order all those things.
And do you have a computer in front of you, or are you just sitting there talking to them?
Oh, I have a computer in front of me because I have to, when they're talking,
right.
I need to be able to review their labs, look at what their medication list is, what allergies they have. I want to be able to see all that very easily.
Now, you're pretty fast. Some of us are a little slower than you, so it's going to take us a little longer, I guess, to get up to speed. No?
Well, we've been on this certain computer system, Epic. We've been on that for almost a year. I think.
Oh, wow.
All right, so we're at an end here, but this has been very, very interesting.
Very fascinating. Yes, Dr. Lorne Bigley.
Went by fast.
Might as well start it.
Bigley,
finish
Byerly,
it like
whatever.
we started it. Oh, Dr. Lorne Bigley, thank you so much. Peace Health Medical Group Family Medicine. Where's your office?
South Eugene on Hilliard. Thank you very much. This is a pleasure talking with you all.
Now, Dr.